Welcome everyone to the 9th Annual CR Arthritis event at the CRA and AHPA Annual Scientific Meeting. Today I'm joined by Dr. Amanda Steinman, who is a Clinician Researcher as part of the University Health Network and Mount Sinai Hospital, and I believe this is in Toronto.
Yes.
Wonderful. So welcome. Thank you for joining us today.
Thanks so much for having me today.
And Dr. Steinman, I know that your research is in quality improvement, and you also gave a lecture about it this morning. Can I ask more specifically from your perspective, can you perhaps describe how you got on the path of not only rheumatology, but why the interest in quality improvement work?
Sure, thank you so much for those questions. So rheumatology is my passion in medicine because of the incredible patients we see. And I think that we're really at a really critical point in rheumatology because we can do a lot of good and we're learning so much. And so, I'm taking in all of the incredible developments at this meeting, and it's a really exciting time for rheumatology. And I think that, my quality improvement work really stems from my being a clinician first. So while I do lots of quality improvement work, I'm a clinician at heart. And I really wanted to be able to affect change in a real way at a granular level in clinic, where patients could really see the difference in their outcomes. And that was something that resonated quite a lot with me. And that was my path.
That's incredible. And I think, when we describe or try to understand these stories of how people get to where they are, right? The fact that your interest actually came from you being a clinician, in this case, an adult rheumatologist, right? And realizing that there's so much, we've done good, but we can do even better, right? That's why I love the area of quality improvement. Could you describe to me the tool that you have designed to be used in quality improvement that you actually shared with the audience earlier this morning?
Sure, I'd be happy to. So I collaborate in a young adult lupus clinic. And the young adult lupus clinic is for patients who have graduated from pediatric lupus care, in our case sick kids, to adult care around the age of 18. And the model is really meant to support patients through a really, really challenging period in their lives. And so it's challenging not only because they're weathering a chronic disease that can be particularly severe and challenging in childhood, but also it comes at a really, really critical formative time in life when people are moving from high school to university or to college or to getting their first job and having their first romantic relationships and moving away from home, and all of these really, really important life events that are superimposed on a really, really challenging disease to manage. So it's a particularly challenging time. And we know that lupus, it presents so heterogeneously. There are so many things to think about in order to really optimize patient care that in a clinic visit we may not capture all of that. Then we superimpose the transition piece, wherein we really want to be addressing things like school and sexual and reproductive health and mood and how people are managing their medications. And we found that clinic visits they went by so quickly, and we wanted to capture more. So we designed on the basis of what we found we were missing more frequently than not. We designed a template, and it's a practical clinical template. We use it each and every time in clinic, and it allows for us to be absolutely consistent in all of the things that we want to be addressing. Now, if we are asking the questions and we're addressing them and we're finding out where the gaps in the patient's care is or what they're missing or how we can better support them, then hopefully that will lead to quality improvement and we can do a better job for our patients.
That's amazing. And like you were saying, it's very practical, right? So is it for the rheumatologist to use during every visit? And so it's laid out in a way where you're pretty much, it's like a prompt to speak or to touch on certain points? Or is it like a rating scale of, how well are you managing medications from, if you could describe it?
So it's a little bit of both, but ultimately what happens is, as we're having the discussion, there are little cues for us on the back end. And this turns into a clinic note, which from a physician standpoint is really practical because it's not more stuff that you need to do. So this is incorporated into what we're sending out to the family doctors and to the other care providers in their circle of care. And it allows for us to be as comprehensive as we can each and every time. So there are some rating scales and so forth, but really it's meant as a guide for us to make sure we're talking about contraception, to make sure we're talking about bone health, to make sure that we're talking about sunscreen each and every time. And in the context of a disease where the clinical course really ebbs and flows, and there are periods of flare that can go on for many months, and that's really the focus of the clinical encounter, it allows for an easy and quick checklist to make sure we're not missing those other important things too.
Yeah, and what I'm, just so excited about is the fact that it's tailored, right? It's tailored to youth who are going through that transition with lupus. So it's not a template or a checklist, for example, for all rheumatic conditions. And that way you're able to capture the information that's most relevant, because even I can think about a clinical setting where you're seeing so many patients with so many different conditions. This allows for that consistency. And now that you've used it, I'm assuming you've piloted it and you've seen some results, and you've captured this progression over time. What is something perhaps that's surprising or exciting that you didn't expect to see from capturing this information?
Sure. So thank you for asking that, and thanks for your enthusiasm, which I share. I think that the takeaway for me was that it was a really, really simple intervention, and it's led to tremendous and sustained improvement in how frequently and consistently we ask the right questions. And while this particular template is tailored to the young adult lupus clinic, it can be adapted to whatever clinical setting that we really need. And so I think that having those tools embedded in a way that's practical for physicians so that they will use them, I think reflects a really simple but really practical way to make sure we're doing what we ought to be doing. And it's a jumping off point for learning more about the things that perhaps there are gaps and perhaps we can do better. But if we don't ask the questions, we won't know.
Yeah. And I just, like you said, when we think of, making improvements and making leaps and bounds in this field of research, we're thinking like, what is the new technology? But sometimes that's not it. Sometimes it's, hey, how can we communicate better, more consistently with the patient and amongst the allied health professions, right? And that's what this allows you to do. And it's something so simple, right?
And that's just it. I think we need both, right?
Yes.
We need to be on the cutting edge of basic science, but we also need to be able to deliver the care and to connect it to the patients that we see. And so, in our collaboration across rheumatology and beyond, hopefully we can all contribute a little bit. And, we couldn't do this without the input of patients. And so we're so grateful for that collaboration each and every time we come to clinic.
Wonderful. And I have one last question for you.
Sure.
On your quality improvement template, will you be doing some quality improvement on the quality improvement template? Have you gotten feedback on it?
Each and every time.
Okay, so you're going through revisions.
Absolutely.
I love that.
Right, so this is the paradigm of quality improvement, is these rapid cycle changes, right? So we started with one template, then we said, oh, this is actually working pretty well. Let's add a few more things, and then a few more still. And so we actually have gone through 3 major revisions, and we've added things, and we've been able to really, I think, improve the care that we're delivering. So it's exciting.
That's wonderful. And when you go through these revisions, I'm assuming you get the rheumatologists who are using them. Do you also get patient input on, I don't really like how that question is phrased, or I find that one a little bit difficult?
It's interesting because the template is really meant to serve as a guide for us, but the way we deliver the questions is natural, is unique,
Yes.
and is tailored to the individual, hopefully. And so rather than reading off a script, it just reminds me to make sure that I ask about when their last bone density was and if they're scheduled for their next. Or, hey, did you make it to the ophthalmologist? I remember last time you were having trouble finding somebody who would book you within a certain amount of time. Did we follow through with that? And so you're able to be natural.
Yes.
But you're still asking all the right questions, or what we think are.
So excited.
Thanks.
Dr. Steinman, thank you so much for your time. And Anita, do we have any questions from the audience?
I have a question.
Okay.
I want to see, following Ellen's point, do you think it's worthwhile for you to give patients homework to fill out quality improvement forms, because you said the one that you guys have is more for the healthcare provider. So would it be worthwhile to create a similar version for patients?
I think that there's a lot to cover in the clinical encounter, And I think thinking through some of the things that we still feel we want to know more about might be a wonderful way to get that in, is to have the pre-work done. So I think that's a great idea.
Wonderful. I love that. So you have lots of opportunities for more improvement in quality improvement. And thank you so much for your time and expertise.
Thank you so much. Thanks for having me.
Absolutely. With that, we'll see everyone at the next session. Goodbye for now.